Hello, and thank you for listening. I'm a professional with a PhD in my 50s. I'm also a single parent. Through the high-rolling 80s and 90s, I remained countercultural by being thrifty and saving. I always lived below my means. As a result, I was able to get through corporate downsizing and finding new jobs with minimal financial stress. I continued to save. My savings are now completely wiped out. All it took was one major medical illness and my daughter entering college. I've spent my life budgeting, saving, and raising my child to have an ethic of service to others rather than to self-indulge with consumer products and brand names. Despite that, I will now be paying off bills through my 80s. Retirement is not an option. Even more frightening, I'm living paycheck to paycheck despite having a middle income. One more illness and I will have to declare bankruptcy and lose our home. I have inadequate health insurance from my nonprofit agency, and even that will disappear if it closes due to Medicaid cuts, which is its primary reimburser. My annual medical bills are 22% of my gross income. My anger is equal to my anxiety. Our ranking for quality and longevity of life is a scandal relative to other developed nations. I have often worked overseas and have had occasion to use different countries' national healthcare systems. I have personal experience of how inferior our day-to-day, non-heroic care is, except perhaps for the wealthy or for our politicians. In addition, no other country that I have worked in leaves the burden of financing a college education to individual families. My daughter is 18 years old and is graduating from college with a bachelor's degree this May. She skipped high school and started college at age 14. Because she didn't graduate high school and because she wasn't 18, she was disqualified from every scholarship outside her college. It's no accident that 70% of our science PhDs are now being recruited from overseas. From both a healthcare and an educational perspective, we are eating our seed corn. When are we going to wake up? In the meantime, if my agency closes or if I have another healthcare crisis, my daughter will never get through graduate school. Ironically, although she is a Marshall Reserve Scholar, Phi Beta Kappa since age 16, and has interned with one of our national security agencies, no U.S. graduate school will accept her. She's having to apply to graduate schools overseas, who consider her age to be an asset and not a liability. What a colossal waste of our national human resources, of our future. We truly seem to be sinking into mediocrity. Why are our healthcare and secondary education failures not front-page news? With Medicaid cuts going deeper and deeper, both from the working class and the working poor, and those that serve them, they are being squeezed into deeper poverty. Why is there no loud debate over this very real and ongoing cost to our society? My name is Dr. Jennifer from Shawsville, Virginia. I demand health action now.